If you've breastfed or pumped for any length of time, you most likely have had a clogged or plugged duct at some point in your journey. Plugged ducts, often called clogs, are an area of inflammation in the breast where milk is plugged or clogged and not flowing as it should. Plugged ducts are very painful and should be treated as soon as you notice one to prevent it from worsening, becoming infected, or turning into mastitis. In this video, I will talk about the most common causes of plugged ducts and how to treat them. Some people are more susceptible to clogged or plugged ducts than others. The most common reason that I see for plugged ducts in the early days and weeks after birth are from a shallow latch or from a baby with a tongue tie. The breast is made of a ductal system that carries milk from the back of the breast where it's made down to the nipple and out to the baby. Those ducts are very tiny tubes that are very easily compressed. When the baby is in a shallow latch or has a tongue tie, they compress and pinch the nipple, which pinches the ducts and does not allow milk to empty effectively. This causes a traffic jam further up the breast. Another reason for plugged ducts and mastitis would be for people with an oversupply, those who exclusively or frequently pump because they are either pumping with the wrong size flange, a poor quality pump, or with the suction too high. Those with a history of breast implants and reductions because there is a surgical history are also at a higher risk of having plugged ducts. Anytime you go longer than normal between your usual feeding or pumping routine, you are at the risk of milk sitting too long, which causes the ducts to become inflamed or too full of milk, which then doesn't let them empty as well once you go back to feed or pump. I often see plugged ducts or mastitis as either baby is sleeping longer at night, either naturally on their own or with sleep training, and the mom is not getting up to pump just for the initial stages while their body is trying to regulate that milk supply, and when going back to work because of timing of pumps, not being able to get away to pump, or possibly even pumping for the first time. Again, maybe with a poor quality pump or the wrong size flanges. Plugged ducts can also occur from wearing clothing that is too tight or sleeping on the breast in a funny angle. While you can wear an underwire bra while breastfeeding, for some people, depending on their breast size and shape, the underwire can prevent milk from flowing in and out of the breast and can contribute to those recurrent clogs. Anything that inhibits the flow of milk through the breast has the risk of causing a clog. So any of these reasons or a combination of these reasons could be the culprit for why you're getting plugged ducts or recurrent plugged ducts. We always want to find the reason why and then be able to treat that first to prevent them from happening again. Clogged ducts are usually hard, painful, tender lumps that can occur anywhere in the breast, but typically are in the outer side of the breast closest to the armpit. Depending on where they are can tell you what the culprit is for why they're being caused. A good qualified IBCLC lactation consultant can help you figure out why that clog was formed, especially if you find that you're getting multiple clogs or they are recurring often. We used to recommend heating the breast before feeding or pumping. If you are going to heat the breast before pumping, you want to make sure that is a gentle heat and not too hot. We want this milk to flow, and heat can actually perpetuate the inflammation that's causing the plug. So if heat sounds good to you, you can use some gentle heat for a few minutes before feeding or pumping. But we want to reduce inflammation. So the new protocol says that you actually want to use ice. Ice will not decrease your milk supply. It will help reduce inflammation. Yes, we will often use ice in the weaning process, but that is when we are not moving milk as frequently. It also helps reduce inflammation when we are in a weaning process. When we have a plugged or clogged duct, we are using that ice after feeding or pumping, or between feedings and pumpings, to help reduce inflammation in the breast, to allow milk to flow more freely without pressure on that ductal system that's not letting that milk flow freely. We don't want to be aggressive using lactation massagers or tools that again can increase the inflammation that's in the breast. Instead, we want to use very gentle movement techniques in order to try to help milk move freely. Maya Bowman has some great breast gymnastics that can help get milk flowing again without increasing the inflammation. That looks like gentle moving of the breast up and down, side to side, and around in circles. You can also encourage milk to flow into the lymph system, which is the waste removal system of the body, by doing gentle massage and compression of your milk and that inflammation up into the armpit or into the lymph above and below the collarbone. You can also see my video on lymphatic drainage massage as another technique to try to help reduce that inflammation and get your milk to flow again. If you are doing massage of the breast in order to help empty a plug, we want to think of that plug like a traffic jam. You can't push from behind in order to be able to get the traffic jam out. One of the best strategies for removing milk in front of a plug to help you release the milk where there's inflammation is to use your hands and hand expression. You want to try to move in front of the plug, working your way back. So if you have the plug on this side of your breast, you would do again the gentle breast gymnastics, a little lymphatic drainage massage, and then start with your fingers in front of the plug, expressing milk in front of it, and gradually working your way back to where that area of inflammation in the plug is. You can gently work around the borders of where that lump is to help use your hands to empty that milk where it's sitting in that inflammatory pocket. You may have also seen strategies of using a haka or a bowl of water with Epsom salt soaks. I have definitely found this helpful for some people to help move those plugs and get them out. It's actually quite fun to see the milk pull out of the clog and be able to move more freely. The new protocol does caution use of Epsom salt soaks and using of a haka because for some, depending on their breast anatomy, this can actually cause more damage and harm than good. Too much suction on that breast can further the inflammation and not allow that plug to move freely. So if you've used that technique and found it helpful, it is one strategy in your bag of tricks, but you want to be very careful if you are going to do that method, as it can cause further inflammation and damage for some. Other strategies for getting those plug ducts removed is changing your baby's nursing position. If you normally feed in a cross cradle position, you could put baby into a football hold, laid back, koala, or even side lying. By changing baby's position to the mouth, this can help effectively empty those clogs in different spots of the breast. You also want to adjust any shallow latches that may be contributing to those plug ducts. If you have any concerns that your baby may have a tongue tie, you'll want to have your baby seen by a quality IDCLC who's been specifically trained in ties. Not all lactation consultants have done the additional training in order to be able to effectively identify a tongue tie. Castor oil packs are another homeopathic or naturopathic way of reducing inflammation to help get rid of a plugged duct. What you would want to do is get high quality cold pressed castor oil, such as that found at most natural food stores. You would take a very large piece of cotton, such as an old t-shirt or flannel cloth, and fold it 3 times for thickness and make it the size to cover the plug. You would saturate this flannel cloth with castor oil and warm it in the microwave. Do be careful to be aware of hot spots, so wring it out so that the castor oil remains wet but not dripping, and that the entire surface is the same temperature. Apply the cloth directly over the plugged area. Cover it with plastic wrap and then apply heat to it, such as a heating pad or a hot water bottle. Keep this in place for 20 minutes. After the treatment, rinse the breast off so the baby does not ingest the castor oil. Then you would feed or pump as usual. You can repeat this treatment 2 to 3 times a day or until the plug is cleared. Often the plug will resolve itself within 24 hours. The flannel pack can be reused several times, so you can place it in a Ziploc bag for each use. No need to wash it, as it can be used multiple times. If the castor oil dries out from the cloth, you would add more oil as needed. Another way to help prevent and treat plug ducts are nutritional supplements. Probiotics are a great way to help improve the breast microbiome. There are 2 specific probiotics that are, per the research, known to help improve the microbiome of the breast. The first is L. salivarius and the second is L. fermentum. These two probiotics in combination have been found in the research to actually treat and prevent mastitis and plugged ducts. There are multiple brands on the market that you can find, although the most bioavailable probiotics are ones that are liquid and need to be refrigerated. You can find many of these on the shelves of Whole Foods or a natural food store, and there are also several specific probiotics made by bigger lactation companies that have these two probiotics in them to support the microbiome of the breast. Taking supplements like sunflower lecithin and choline have also been shown to be effective to keep the fat from sticking in the milk to help it flow more freely through the breast. If you have a really stubborn clog that is just not moving with all of the other tips and strategies, therapeutic ultrasound, which is often done by either a breast specialist or a trained physical therapist, is a great way to break up that clog using ultrasound frequencies. I've seen this very successful in my patients when they have that service available in their area. It is completely safe for your baby to continue to breastfeed while you have a plugged duct. You do not want to overfeed or overpump during this time because that can actually increase your supply, which increases the demand on the breast and can increase the inflammation overall. You want to maintain whatever feeding or pumping schedule you naturally have. It is safe to continue to breastfeed and offer your breast milk from the affected side. Your milk may appear bloody, stringy, or even sometimes like the consistency of melted cheese. It is usually not a problem for baby to ingest this milk. Clogs or plugs can be painful and scary, but being proactive can help. If you are consistently getting plugged ducts or you have more than one, make sure you're either reaching out to a qualified IBCLC lactation consultant or a breast specialist to help you figure out why. Now you know.